Thank you very much, Alistair. Well, as everybody appreciates, the coronavirus pandemic hit us very quickly and very hard. And our initial crisis response was obviously to protect vulnerable cancer patients, people with deficient immune systems, because what we didn't want to see was a huge wave of coronavirus infection among our patients. So we had to move quickly to make sure that we could protect patients, to identify those in whom treatment had to continue because the balance of risk was greater from the cancer than from the coronavirus. And in doing so, we've done a lot of modification of the way that we look after people. We've done remote consultations. We've brought through approvals for new drugs to make treatment easier and safer to deliver. Some people have been switched from having major surgery to radiotherapy, for example, and we've brought in the independent sector to give us greater capacity to develop COVID-protected sites where we can look after people. And we've done things like maintain proton beam therapy in the NHS for those patients for whom it was essential treatment. So overall, we've done that. We've largely protected, I'm glad to say, people with cancer, and our recent look at the Office for National Statistics showed that we haven't seen a big jump in mortality among people with cancer during March, April and May, which is, in the short term at least, very comforting, but we do realize we've got a lot more to do. And we're now managing in very new circumstances, recouping the backlog which has built up as we've seen a big dip in referrals into the system, and adapting our pathways to the new environment in which infection control and the prevention of transmission of the virus is an important and dominant priority. So we've issued a series of set of guidances, the most recent of which came out yesterday, about restarting the system and starting to recover the position. We've started to see our urgent cancer referrals rising steadily again. They dipped to their lowest point just before Easter and are now up above around 60% of what they normally are. And we've seen the numbers of people having chemotherapy and radiotherapy coming back towards normal. And we've done things like accelerating our stereotactic radiotherapy, the so-called SABRE program, to make sure that that's available. And we're carrying out around about 3,000 cancer operations a week, which is quite a high proportion of what we would normally expect. We've asked the system to make sure that we've got capacity so that people referred with suspected cancer can be diagnosed and treated promptly. We've asked them to make sure that this is being done in a fair way and that access to cancer diagnostic and treatment services are equitable and, very importantly, based on clinical priority, and that people can have confidence that their diagnosis and treatment will take place in an environment in a way that's safe. And we've obviously got people who've been waiting some time for cancer surgery because much of the operation capacity was put on pause when the pandemic was at its height. And we're now asking people to start recovering that, looking after patients who've been waiting for treatment to make sure that they're a priority alongside the new referrals based on the basis of their clinical urgency. There are obviously plenty of concerns about how we deal with the new normal, particularly from my point of view, how we restore diagnostics. We need to, for example, do a lot more endoscopies in order to diagnose bowel cancer and stomach and esophageal cancer. And that's taken a very big hit because of the infection control precautions that we need for people who are having those procedures and the staff carrying them out. And we need to update and streamline our diagnostic services. A number of people have identified that, for example, CT scanning capacity, a lot of which was diverted during the pandemic to make sure we were diagnosing people with coronavirus, we need to make sure we restore that and that we expand our capacity and that we streamline our diagnostic pathways. And we're doing a lot of work, and we're out consulting on that at the moment amongst the experts. If I have some take-homes and some ideas from what we've been through, I think one of the most striking things about the way that things have gone over the last 2 months is this extraordinary coalition of patients, of cancer charities, of academics, of healthcare professionals across all groups who've really come together. And this has been an enormously cohesive and purposeful undertaking to get us through the crisis. And we've been doing weekly calls with charities, with cancer alliances, with the cancer centres all around the country, and I've been interacting with our Patient and Public Voices Forum very regularly as well. So we've had an enormous amount of input and help and ideas, and we're later on next week pulling together a summit of the academic modelers to help us to understand where the greatest risks are in the system and which patient groups we need to prioritize most highly to avoid harm downstream. So huge efforts have been made to adapt and maintain essential treatment by my colleagues on the front line in the NHS. But I think we've learned an enormous amount about how we cope. And we've also managed to sharpen up ways in which we can work in the future. So there's an enormous amount to do, but I think we've learned a lot in the process about how to respond and how to make the most of the facilities we have at our disposal.
Peter, fantastic. Thank you very much indeed. Enormously grateful for that.